हेलो, इन्हीं बोला था मेरो इयरफोनले काम गर्छ गर्दैन त्यो टेस्ट गरेको के भन त।
आइरहेछ है सर आवाज?
ल आइरहेछ ल ल ल।
आइरहेछ। यो त टेस्टिङको लागि मात्रै हो रे सर, अब अर्को उसमा अब उसमा जाने हो कि?
ठिक छ ठिक छ।
Rakesh sir, we will be in this we do not have to switch any browser, right? We do not have to switch any links. You are in mute.
You can just keep as it is.
Okay.
So, okay. So welcome everyone to this live session on health risk, its multiple dimensions. This session is being organized by Risk Management Association of India in collaboration with BIFI and Nepal. So just to briefly, many of you must be knowing about RMAI. I will briefly introduce our organization. Risk Management Association is an NGO engaged in promotion of risk management culture in India. The basic objective of our association is to promote awareness about risk management and act as a platform for risk managers, insurance professionals, bankers, corporates to share ideas and experiences for development of the industry. Our activities include publishing quarterly bulletin, seminars, conducting seminars, creating repository of information related to risk management at our website rmaindia.org, organizing technical research paper contests, and so on. And so, in the lockdown, we have organized number of seminars over the last few months, and we continuously plan to hold webinars. Recently, we have launched a course, online course on risk management too. So, in our today's session, we have Dr. Abhijit K Chattoraj. So, before I introduce him, we also have with us Dr. Binu Datreya, CEO BIFIN. So he will also brief about BIFIN and give a concluding thought. So regarding the flow of the program, once the session is over, we will have a question answer session. So you can keep your questions ready, and we will have it at the end once the session is complete. So just to introduce Dr. Chattoraj. Professor Dr. Abhijit Chattoraj is a chartered insurer. He is the professor and chairperson, Program for Insurance Business Management at Birla Institute of Management Technology, BIMTech. He is also the Vice President Honorary of Risk Management Association. Dr. Chattoraj is a well-known academician and an insurance professional associated with many reputed institutes like National Insurance Academy, Pune, as faculty member, chairperson, PGDM. He headed Amity Business School, Amity University, Mumbai. He served a very well-known public sector insurance company for more than 20 years in several capacities. And he has been associated with Insurance Institute of India as a resource person and visiting faculty for years. He has an extensive experience in management, marketing and insurance, teaching and training. His forte lies in organizing high-end management development programs in service and brand marketing, health insurance, and other streams of general insurance business. He is the co-author of highly acclaimed and appreciated books, Basics of Health Insurance Claims Management, and Catering to the Needs of Health Insurance Professionals. He has also co-authored a book, Health Insurance in India, a Review. Recently, he has also written a book for CII London. So now I'd like to invite Dr. Chattoraj to start the session.
Thank you, Dr. Rakesh and Dr. Priya, for this opportunity, and thankful to all delegates. Am I audible to everybody?
Yeah,
Yes,
we can
Am I
hear
yes.
you.
audible? Yeah.
Yes, yes,
Yes.
we can hear you.
Okay. So today we are going to talk about health risk and its multiple dimensions. So we'll start with try to understand what exactly we mean by health and what exactly health is all about. I have a feeling that not many people really appreciate the entire dimensions of health. And that is what I'm going to exactly do today. I'm going to clarify those issues. Dr. Rakesh, can I be showing the bigger view of mine? Is that possible?
Yeah, yeah, I'm doing that. Yeah, Dr. Atya, you can switch off your camera.
Yeah.
Yes.
Right. So before you start, it's like how do you look at health? How most people look at health. Health is always looked at by most people as an individual trait. So when you look at something as an individual trait, so the problems that you face out of health that you alone face, if there is happiness surrounded with health, that also you face in your individual capacity. But when there is problem, the kind of problem when one faces when somebody is ill or somebody is in divorce, and then you have a lot of emotional problems, and you also have financial problems. That's the time when you feel that health should not be really seen as an individual problem. It's a problem of the family. It's the problem of the community. It is the problem of the entire society and entire nation. And that is how health is looked at today all over the world. Look at the problem today we faced out of COVID. All the nation, every nation is affected by COVID today. It started as an epidemic in Wuhan, and from Wuhan it traveled to all parts of the world. It went to India, it has come to India, it has gone to Nepal, it has gone to Bangladesh. You go to any European country, any country in the world, everywhere it has traveled. So an endemic became a pandemic. So the difference between endemic and pandemic is that endemic affects a whole huge reason. It affects a whole huge population. But most often, it's limited to one reason. So when endemic becomes pandemic, it becomes pandemic only when the P comes into the picture. P is what? When endemic gets a passport, that is P, it travels beyond the boundary of a nation and it becomes a problem of the entire world. And that exactly has happened with the COVID. It's not the problem of one community, it's not the problem of one society, one nation, rather, it's a problem of the entire world. Now, when you look at health as an individual attribute, you tend it, mend it, repair it, enjoy it, whatever way you do it. The society doesn't come into the picture. If there is a problem, as I said in the beginning, emotional or financial or both, it has to be borne by you, it has to be tackled by you alone. But that is how health cannot be looked at. The society has a responsibility. The society has a big responsibility to tend its health. And that's the reason today we call it community health. Today we call it population health, health of the entire population. We do not in any more talk, when we talk about health, as a problem of an individual. Yes, it is a problem of an individual, but health is necessarily or essentially is a problem of the community, is a problem of the nation. It's a problem of the world. That is how the health should be seen. That is where the society's economy, the society's social condition, the society's technology level, all this comes in the picture. And any society which has a better technology level, better social condition, better political condition, has a better health. And any country which has a better health has a better output. because health is all about output. When I talk in terms of human capital, it is all about health. It's the health, and I'll talk about what are those things that we look at in health that really determines what is exactly the health capital. But before I talk about health and its dimension, let me look at a very standard definition given by WHO. The WHO definition says that health is a state of complete physical, mental, social well-being, and not merely the absence of any disease or absence of any infirmity. Now look at the word, a state of complete physical well-being. It talks about complete physical well-being, but at the same time, it talks about complete mental well-being. But one most importantly, what does it talk about? It talks about social well-being. Now, why? All along, we think whenever there's a problem, it's a physical problem in health. But look at the definition. The definition has traveled beyond the physical aspect. It talks about the mental health. It talks about social well-being, and not merely the absence of any disease or any infirmity. Now, why this social dimension and mental dimension added to it? Then, if you look at it very clearly, yes, in COVID period, it is the mental health which has taken a huge beating because of the mental well-being that is so pronounced in all of us that we are not going out anywhere. We are keeping inside, locking ourselves indoors. People have started moving out, but what they are wearing masks, they are maintaining social distance, they are maintaining physical distance, they are carrying all sanitation equipments with them. So wherever, whatever they are picking up, they are sanitizing them, and then they are picking up it. Despite that, COVID is not showing any sign of abating. So the health, more than the physical health, which has really taken a beating during COVID, is the mental health. Many people have gone to depression bound. Many people have lost their jobs. Many are not working. Many have nothing to eat in their family. Look at the poor family. They have been not going to the work. There are less work. Of late, things have started coming back to normal. But look at the period, 3 months, 4 months back. Everything came to a standstill. People can live without food for 1 day, 2 days, but not for months. People can live without employment for a few days, not month and month alone. That's not possible. You all require money. We all require some sort of employment to fend ourselves for the different requirements, the needs. That's where, as I said, the mental health has taken a big beating. Now, the social well-being, which is very, very important. I came to Delhi from Pune, and in Pune, the social life is extremely good. Delhi has a poor social life. People don't travel late in the night. Why? The reason being, the night are not very safe. Proper Delhi things are slightly better, but outskirts of Delhi, I live in the NCR part. NCR is National Capital Region, and that includes Gurgaon, that includes Ghaziabad, that includes Faridabad, that includes Greater Noida, and I'm in Greater Noida. Greater Noida is one of the finest places we have in India. A huge, a very good-looking place, proper planning, roads are wide, but the social life is not that safe. It's not that secure. It's every time we go out, we're not very sure we'll come back safely or not. It's a social life that matters a lot. It decides whether you will move out or move in. It restricts your movement. Every time you move out, you have a feeling, I must come back safely. I used to stay in a state called Bihar, which is very close to Nepal. Bihar also, the social life, as long as I was there, social life was not very, very good. It was extremely bad. And when social life is bad, it does affect our health. So please try to understand the definition of health encompasses not only the physical health, the mental health, it also talks about social well-being. This was the definition given way back by WHO, World Health Organization, Not many people knew about WHO before COVID. Now that we have COVID, WHO bulletin every day, and every day we look at what our WHO is talking uh, about COVID, whether we'll have medicines or not, whether some sort of medicines will be developed in near future so that we can come out from this spell of COVID. So everybody is now hooked at the WHO. And there are people who are talking negatively also about WHO, and they are questioning its role in tackling COVID. So that's the reason WHO is in news. But WHO is the leading World Health body, and it works very sincerely in many areas to promote good health all over the world. Now, WHO initially started with this definition, and then they modified the definition, and they said good health means it should include lead a socially and economically productive life. So, if you have good health, then you should be leading what sort of good health? Life. Socially good life and economically productive good life. Socially productive good life, economically productive good life. That's what health should mean. If you say that you are a good health, if you are not productive socially or economically, then we say you do not enjoy good health. If you are enjoying good health, then you have to socially productive, you have to be economically productive. Now, what does it mean, socially productive? We are into a lot of social engagements. We are social animals. We live in the society, and society matters a lot. Look what society is made up of. The society is made up of families. Good families make good society, and good society makes good nation. Now, what is meant by good society? A good society is a society where are good institutions. What does that mean? Having good institution? Having good institution means you should have good colleges, you should have good schools, you should have good transportation facility, you should have good communication facility, you should have absolutely brilliant law and order situation, you should have a very lively, very working healthcare system. Now, what has happened to the healthcare system? All of a sudden, COVID cases started spiraling. It started increasing. And what happened? All of a sudden, we realized the country does have plenty of super specialty centers. But what it does not have really is primary healthcare center, good primary healthcare center. That is what the country requires. Unfortunately, country like India, city like Delhi or Bombay, or you go to any part of India, Bangalore or Calcutta or Hyderabad or even two-tier cities, you go and you find plenty of super specialties hospital. In Greater Noida alone, there are 10 super specialty hospitals. So look at the number of super specialty hospitals. But unfortunately, we do not require super specialty hospitals. A good healthcare system requires good primary healthcare system. And believe me, if we had good primary healthcare centers, things could have been much better in India than what it is today. A problem like COVID, a problem like pandemic can be much better treated in a private healthcare center, in a primary healthcare center than any other institutional settings. Big hospitals really we do not require. So look at the definition. The definition says it means complete physical, mental, social well-being and not merely the absence of disease or infirmity. And then it goes on to add, it says that good health means that you should be able to lead a socially and economically productive life. What does economically productive life means? You should be able to generate income. If a population, if a person, if an individual, if a community is not able to generate income for itself or for its own people or for people, other people also, then to us that population or that individual or that community is not economically productive. That is not economically productive. For economically productive, you must generate income. One must generate wealth, and that is a sign of good health. That is the reason everybody say that health is wealth. Why people say that health is wealth? But because good health is capable of generating good income. That's the reason I'll be discussing a little later the various yardsticks which by which we look at whether we have a good health or not. Now, having this defined health, if you have some queries, you can ask me these questions, or else I will go ahead. So somebody has to. If Mr. Agrawal can help me, that if you have some queries, I can take queries here and then possibly move on. That will be better. If you have any query, anything that you want to understand, please you can in the chat box also you can write. I can immediately look at it, or else I'll move on.
Yeah, I think you can move on. Currently,
Okay.
we don't have any.
Okay. Now, the risk in health, that's very important to understand. What is risk in health? And what is risk in life? The risk in life is known as mortality. The risk in health is known as morbidity. Now, before I go and explain you what is morbidity, what we always say that this morbidity, which is the risk in health, and health, meaning good health, this is a continuum. This is like this. So good health is, if you give it a weight, good health, an ideal health is will be always one, and a morbid health or a bad health will be always zero. So nobody's life is either one or zero. It is always in between one and zero. So that's the reason we call it a morbidity or health continuum. And in this continuum, every day, every week, every month, we keep on moving from one direction to the other direction. Say, one is the highest health. If we are at 0.95, 0.98, that's very good. 0.9 is also very good. 0.8 is also very good. So if we are in 0.8, we want to move on to 0.8, 0.5, 8.9 or 9. But if we are closer to zero, say my health is 3 weighted or 3.4, that means I have a morbid health. That's a very bad health. That is where I have a disease and I have a very serious disease. So when the improvement takes the disease state, we move on from that morbid state in the continuum from 3 to 5, gradually closer to 7 or 8. When you are closer to 8 or 7, possibly, then you have better health, not the best health. Best health, as I said, the ideal health should be always closer to 1. So therefore, we say this is a continuum, and the health keeps on fluctuating from one end to the other end. These are some of the facts. I don't know whether you are able to look at it or not. Can you look at it?
Yeah, it is there, but it is a little small. You can just explain, no issue.
Okay. This is something which I'll come back. In fact, I'm also not able to look at it. Maybe my. So what we have the population. Sorry, just a minute. Line hold on. We have this population, and you will find India's population is close to 1.33 billion, meaning 133 crores. And if I look at the population of Nepal, it's only 29,305. So what is the population of Nepal then? 29 lakh or 29 crore? Any idea?
No, can't tell.
Anybody can say? There are many participants in Nepal from Nepal. What is the population of Nepal? Can anybody tell me? I'm giving you the figure. What does that figure mean?
You
Any
can
idea?
write it on the in the chat box.
So in the chat box, if I go, I don't know how to go
No,
to.
no,
Might be
no.
above 3 crores, sir.
Huh? So any idea? What is the population? Tell me. Let it be a little in. My chat box is not.
30 million, 30 million, around 30 million. 3
30
crore.
million means 3 crores.
Yes.
Yes, it is close to 3 crores. That's precisely what it has been shown here. It's close to 30 million, and 30 million is 3 crores. But look at India's population, 133 crores. 133 crores. So India's population is huge. Therefore, India's problem is huge also. So what kind of expenditure Nepal government makes and India government makes? India government makes only 3.6% of the, if India's GDP is also one of the largest in the world, possibly the 5th largest in the world, and India makes around 3.5% expenditure on its health. That's the GDP's contribution to health, or health contribution to GDP. Nepal is slightly better. Nepal makes around 6.3, but the problem is Nepal's GDP is less. India's GDP is huge, and therefore India's 3.6 is quite big. But that still is very, very less when you consider it. You'll have the with other countries, and you will find other countries are spending a lot much than what India is spending at the moment, or Nepal is spending at the moment. The next slide is what we call life expectancy at birth. What does life expectancy at birth means? Life expectancy at birth means the day if you are born today, how long are you going to live? And that's a very, very important indicator all over the world. If I look at India, life expectancy at birth is only 68 years, meaning a man born today is likely to live only 68.8 years. It's very high in Bangladesh, much higher than India, of course, 72.7. And if I look at Nepal, it is 70.5. So both Bangladesh, even Sri Lanka has even better, 75. Thailand has even better, 75. Japan has 84. China has 76. All these countries, the life expectancy at birth is better than India. India, as I said, is a huge country, huge population, and unfortunately, that's the reason our life expectancy at the birth is improving, has not improved as much as it should have improved. So what I find from this figure is that India is 68.8 because most of the participants are from Nepal. So Nepal, as I said, could see 70.2. But that's one way of looking at it. If I look at healthy life expectancy at birth, which is the second one, there also I find Nepal is 61. Healthy life expectancy of Nepal is not as good as its life expectancy at birth. But India is 58, Bangladesh is 63, Sri Lanka is 66, Nepal is 61, and Thailand is 66. So healthy life expectancy at birth means that if you are born today, next 60, if it is Nepal, next 61 years in Nepal, you are likely to lead a healthy life. A healthy life means you are free from disease, physical disease. But as I said, in the definition is broader. It doesn't only include the physical health, it also includes the mental and social health. I'm not going to the next slide. I'll social determinants, because I come here. As I said in the beginning, morbidity means what? Morbidity is the risk. If somebody asks you what is the risk of health, the risk of health is morbidity. And morbidity is made of two Latin words. In Latin, it is known as morbidus. In French, it is known as morbidin. In Spanish also, everywhere it is called it starts with morbidus, morbus, meaning disease state. And morbidus is therefore is the root, is the Latin word. And from this Latin word, the word morbidity means has come. Morbidity means a disease state of health, a state of health where somebody is afflicted with some kind of disease. This is what exactly is written here. It means the ratio of incidence of an illness to the population in a given area. It is also defined as incidence of a disease in a population. As I said, health is not an individual problem, and it should not be seen as an individual problem. If it is seen as the individual problem, then what will happen? The state will not take the responsibility. It is the state which should take the responsibility. Right from the beginning, I'm maintaining that health is a community problem. Health is a family problem. When I say health is a family problem, health is a community problem, health is a population problem. So I'm extending the scope of health from family. Community is extension of family, and society is extension of community. So it's society's problem, and society is composed of population people. Therefore, it's people's problem. So whenever we discuss health, we always maintain that it is population's problem. It is population's health that we are talking about. It's always used, often used to denote a particular disease or comparing different population with reference to a particular disease. Now, morbidity is also defined in a way when we say it's a departure, both subjective or objective, from a state of physiological and psychological well. Departure from physiological well-being and psychological well-being. What is meant by physiological well-being? Physiological well-being means normal state of health. And pathological state of health means something wrong in it. That's the reason we go for pathological test. So physiological well-being means, or physiological well-being means it's a state of health where your health is normal, your normal health in normal condition. Pathological health means you have some problem. There is some derangement in your physiological health, and that leads to pathological health. And pathological health is a difficult area. Then we go for pathological trace in order to ascertain what disease we are suffering from. Right? So these are some of the terminology you should be very be familiar with. So physiological well-being. So physical state of your health should be good. And then psychological well-being. Psychological well-being is mental well-being, the well-being of the mind. So any departure from physical well-being and my mental well-being will lead to morbidity. And please try to understand, mental derangement is a serious derangement. I've seen plenty of people who do not have mental well-being. I have met young guys who have lost job, who are uncertain whether they will continue with their jobs or not in the current COVID situation. They are very upset about their life. Someone wanted to marry and he has lost a job. He doesn't know what will happen to him in future. And his mental health is in disarray. You are not people who with who you want to chat, with who you want to meet. The physical touch is very. Those who go for technology, everybody talks about technology, and they believe that technology is a magical wand in your hand that can cure anything. Please try to understand, technology cannot cure mental problem. Mental problem can be cured only when there is something beyond technology. You require human touch. What do you call it? Humanoid touch of a human being. That's what the reason You have festival in the house, in your marriages. Why people? Why your relatives come? Why you invite your friends? There is a scientific reason behind it. The reason being the gathering relieves your mental pressures. You get to know your own people with whom you grew up. Your friends, your relatives all come. And when you meet with them, exchange views, exchange pleasantries, all of a sudden you feel much better. That is the reason in marriages, in religious functions, in social functions, we call our friends, we call our relatives. It works wonder with the mental health. And mental health has gone for a toss in COVID period. We are not able to meet our own friends over phone, over virtual platform, the way I am talking with it. Even now, I'm not able to see any of you. It gives me a feeling I'm talking to a wall. I don't know whether you are really able to understand me or not. I don't know. That's the problem of the virtual world. It has its own limitation. But when I teach in the classroom, when I look at my young student or the professional I teach, I can make out from their body language, their mood. If I find their mood is not well, then I crack humors. And by that, I try to bring them back into the class. That's how I increase the engagement in my class. Those things are not possible in a virtual platform. So technology is important. It plays a big role, but technology cannot take away or cannot replace the human touch. Therefore, human touch is very, very important. Any activity where there is no human touch, that activity becomes incomplete. I was looking at it, and and as a found that uh, the morbidity definition says departure from physiological and psychological well-being, and that departure can be both objective or subjective. Subjective, I do not have a good mood, I'm not feeling well, and it affects my productivity. And good health must be productive economically. If it hurts my productivity, I'll not be able to generate income on that day. If it hits me for a month, I'll not be. It's not only the physical health that hits my income generating capacity, it's the mental health also that hits my uh, income generating capacity. It's the social health, the society where I am living. A Bombay society, Bombay is the commercial capital of India. Why? Because income generation is much easy in Bombay. Calcutta is not. Ask Dr. Rakesh Agarwal and he will tell you, in Calcutta, life is not that. Social life is not that. You cannot generate income the way you generate income in Bombay, because that's the commercial capital. The bent of mind, people, everybody is professional. Most people you talk the taxi wala in Bombay. Even he is professional. He will not waste time. When he is working as a cab driver, he knows what is his job, and he is very professional in his way. So professional, as I said, is the commercial capital of the country. Commercial activities are at much higher level. It is not at that level even in Delhi, because of the simple reason. The social life of Bombay is far better than the social life in Delhi. Even not many people in Calcutta will accept the fact that Calcutta does not have social life. I've seen people are very happy. But happiness is one thing. That happiness must translate into productivity, economic productivity. If that is not translating into economic productivity, then you are not adding wealth to your country. You are not adding wealth to your society. So social well-being is a very, very important thing. And that's the reason I remember that day. Everybody knows about Maruti's incident. It was to be open in Calcutta. It could not be opened in Calcutta because the political upheavals in Calcutta in West Bengal was very, very different. Gujarat seized off the opportunity and the factory went to Gujarat. Today, that's what places offer. Many places in country, every place, every city is today vying with another city in order to provide better facilities. And that facility, they create facilities where the social well-being and the mental well-being is taken care of. Now, when I look at the risk of morbidity, what really affects the morbidity, and I call them morbidity risk, and I also call them dimension of morbidity. So morbidity is the risk, and that risk gets influenced by what? And I'll be talking about the factors, the components, the attributes that affect morbidity. And the most important morbidity area or attributes or dimension is the physical dimension. Your genetic makeup, the development level, the race, the sex, all adds to an individual's physical dimension and strongly influence health status and health outcome or health practice. Now, genetic makeup. Look at an average German. Look at an average Japanese. Look at an average Indian. You will find physically a German is far more stronger. Even a Japanese, even a Chinese, even a Nepalese. Look at their constitution of body. Physical makeup is better than most of us in India. There can be many reasons. But if you look at the gene, you will find the genetic makeup is very. Even within India, the people from Haryana has better genetic makeup. Punjab, people from Punjab, they are tall, sturdy, strong. People from Kerala is another area which is coming up very fast. Not many people in India notice that. Average Malayalis are taller today. Most of the average Malayalis are taller than most Indians today. If you take out Haryanvis and Punjabis, what is the reason? Because of the economic development that has taken place, that there has been some genetic change also that has come. So physical dimension plays a very important role in morbidity. I know the people from mountains, people from, say, from the Himalayas, the Shivalik, Nepal, I think, believe the part of Shivalik, or Uttarakhand in India, or those who live in mountains. Or think of people in Africa, those who live in closer to equator. You know, equator, the temperature is extremely harsh there. It is extremely hot in the daytime. Around 4 o'clock, it rains heavily, and evening is very cold. So all the three things are there: heavy rainfall, warm afternoon, and very cold evening. And those who are living closer to equator, they have to be very sturdy, very strong people. If they are not sturdy, if they are not strong, they will not be able to survive there. So their genetic constitution is such that they are able to survive that severe weather condition. If I go closer to equator, I'm not able to survive that climate for a few days. But look at those who live in the mountains. The mountains have a different, very cold climate. Not many people can survive that climate. Those who live closer to mountain, they have a makeup constitution. Their body constitution is such they are able to bear that. So physical dimension is very important. Then the emotional dimensions. You know, today most of the recruiters I talk to when I want to place my student, they say, look, IQ is very important. Intelligence quotient is very important. But we are not looking at IQ alone. What we are looking at today is EQ. EQ is what? Emotional quotient. They want to understand how emotionally balanced you are. If you are emotionally unstable, then you are physically, mentally unstable also. Because you're very sturdy, very strong. But if you are mentally disturbed, emotionally disturbed, then possibly it will affect your work. So everybody today, all recruiters are looking, they go for psychometric test, and the psychometric test try to find out what is the EQ level of a particular student. How emotionally stable he is. If he is emotionally stable, I will ask all of you to buy one book by Ms. Goldman. It's called Emotional Intelligence. If you can read that book, you will find that book is very, very wonderful. Look at the way we get angry, and the first few lines of that book says, it is very easy to be angry, very, very easy to be angry. Then it says, but it is very difficult to be angry with the right person, for the right cause, at the right place, at the right degree, at the right moment. Look at it. Started with what? Easy to be angry, but very difficult to be angry with the right person, right moment, right degree. Sometimes we become very angry, sometimes we become less. An emotionally balanced person does not exhibit lot of emotion. He is calm and composed, somebody like Mahendra Singh Dhoni. He comes from a very small city, the city I belong to, Ranchi. And from that town, where there were not many fields, not many stadiums, not many, he used to play in a small ground. And we used to watch him playing cricket there. And when he grew up, look at, he proved to be the best captain in the world. Why? Was he the tallest player in the Indian side? Was he the strongest? He, maybe not. We are not the strongest. Strong he is. He is well built also. But what was very pronounced in his personality? In his personality, the emotional balance was very pronounced. He was emotionally cool. He was emotionally calculated. He was emotionally balanced. He would not get worked up. He will not get angry. He will handle every situation. He will not become very, very happy. So even when he lifted the World Cup for India, both in the one day and T20, other people started, they became very, very happy. They started dancing, frolicking. But Mahendra Singh Dhoni stayed cool. He was happy, but he was not showing that happy. And when India had a difficult time, remember those innings when he used to play very slowly in the beginning, and people would say, he will today they will lose the match because of his slow batting. But look at how calculate manner, in a very calculate manner, he used to anchor the innings. And at the end of the innings, when he was to speed up, he used to speed up. And 80 to 85% cases, he won the match for India. Even the World Cup final against Sri Lanka, I remember the last ball or the second last ball, he hit a mighty sixer and won the one day for India. Even in T20, that was the case. So everywhere, he had a very, very important role to play. His emotional dimension is very, very important. Now, the next is intellectual dimensions. And intellectual dimension comes as it increases your cognitive ability. What is cognitive ability? Your understanding. And there, your education plays a very role. What kind of education you have received. And in education, what was taught to you? In education, in our days, in those are the golden days, we did not go to the best of schools, but whichever schools, government schools, we got. Those teachers were very, very ethically sound people. They made us a good ethical human being. So even today, when I make a mistake, I want to do something wrong, I cannot do it because ethically, it ethically doesn't permit me to do it. But when I find the current generation, they don't even think twice and go for doing things that are not ethically correct. And that gives me the impression that people today are driven more by greed. They want to make more and more money. Money is fine. The wealth is good. But if that wealth, if you do not get that wealth in a right manner, that's where your value system works. You know, in value, there are two values which are very important. One value we call terminal value, and the other value we call instrument value. What is terminal value? Terminal value meaning the value, the thing, the goal that you want to achieve. You want to become a good doctor. You want to become a good teacher. You want to become a good player. You want to become a good entrepreneur. You want to become a good businessman. For that, you have to choose good instrument and then decide. If you choose the wrong instrument, you may become richer, you may become good for some time, but ultimately you will be a loser. That's the reason we always maintain that if you want to grow in your life, choose the right instrument. It may give you results slowly, but you will get a certain result and you will be able to enjoy that result. So when I look at the intellectual dimensions, my mother was not very educated, but her cognitive abilities were very is wrong or right for the family. She always would tell, "No, this you should not be doing." I never knew she could read English, but she was not very fluent in English. She was excellent. And cognitive abilities you get through your experience. You live in the family, you work big no. Educated people tend to look at health differently. Because I know, I read, I understand that junk food is bad for my habit, but still I go for it because my behavior is my influenced by my cognitive habit. I have a greed for good food. It is also by my greed for good food. That again is a behavior. I'll come to that little later. So look at physical dimension, educate emotional dimension, intellectual dimension I'm talking about. Now I'll talk about environmental dimension, where you are, what kind of house you have, what is the sanitation facility. If you look at given you a slide, we are looking for a smart city in India. Almost all become a smart city. That is what Prime Minister Modi thinks. And he is a very visionary man. Avian, look at what has happened. People thought it did nothing. It did marvelous things. Behavior of the people. Today, nobody throws a dirt in the public. Nobody spits publicly. If he looks around, whether somebody is looking at it. Young, small kids will come and tell you, don't do it. Yes, change the behavior of people. It's a very difficult task, not merely of his would say these are all cosmetic things he is trying to do. It was not cosmetic. Please remember, it was a very
Yeah, please wait. Mr. Chattoraj is having some connection problem. He will join soon.
Rakesh, there could be a net problem or connection problem with
Yeah,
the
he is just
network.
rejoining.
Okay.
Till he joins back, I think we will run a small video.
What is health risk? Last week, Risk Bites took a 30,000-foot view of what is meant by risk. This week, I'm looking more specifically at what this means for health risk. To recap, things that are important to us have worth. Bad stuff happens, and that worth is diminished. We can reduce this loss of worth or its impacts through avoidance, insurance, or adaptation. Risk is a number that indicates the probability of a specific loss of worth occurring, and it's important for deciding how to handle the bad stuff and protect worth. Well, so much for generalities. How does this relate to health risk? Here, the worth we are talking about is our health and well-being, and that of the people around us. The bad stuff is all the things that can adversely affect our health, the environment we live in, the stuff we're exposed to, the ability of our bodies to handle it. And the loss of worth is the impact on our health, whether it's as mild as a sore throat or as devastating as a terminal illness. To minimize this loss of worth, we need to know what contributes to ill health, how big an effect we're looking at, and how best to intervene. And this is where understanding health risk, that number that indicates the probability of a specific health impact occurring, is so important. However, calculating health risk is not easy. To come up with a number, we need to understand the innate potential of things to cause harm, as well as how much of them causes what specific harm. We also need to understand how exposure to different agents affects people across their lives, and how they react differently to the things they come into contact with. Risk Bites will be looking at the basics of estimating health risk next week, and we'll be delving further into the specifics of risk assessment over the coming months. So stay tuned and don't forget to subscribe.
Okay.
Yeah.
Am I audible now to everybody?
Yeah, we can hear you now.
Okay. So I was in the environment. Environment is very important. Smart cities that are coming up. So why? One who lives in the slums area, one who lives in the jungles, look at the unsafe water he accesses or she accesses. And I know if you look at the Sustainable Development Goal, which every country is trying, safe water, good hygiene levels, sanitation are important ingredients, important risk of health today they consider. And that is the reason the chart, the figure that I have given, you will find countries like India is not giving the point, but Nepal has given. In Nepal also, 53 or 63% people only get safe water. In India, we don't know how many people really get safe water. Safe water, sanitation, the kind of pollution. Delhi has one of the worst cities in the world where the pollution level is very, very high. And in the winter, Delhi literally chokes. In such situation, it has a bearing on your health. The kind of housing. If you go to Europe, even you go, I have been to Africa, many countries in Africa, and I saw the houses in our days, in Nepal also, Kathmandu and other places, you do not have very flats the way flats have grown up in India. In any city you go up in India, there have been massive urbanization and multiple the multi-story buildings all around with poor arteries, poor road. Look at the way a city like Bombay, Bangalore today is choking. It has grown, but its arteries are very weak. People are living in slums in Bombay. People are living in slums in Pune. Pune is one city which has been growing over the period of time. But what has happened again to Pune? The roads have not widened. This city is choking. So today, the biggest governance issue today in India is the issue of governance issue of, just give me 1 minute, governance issue of, it's a governance issue of urban development, where the environment has really taken a bit, and many people are working on it. We have socio-cultural dimensions also. So kind of economic level, the kind of lifestyle, family, culture, what are the priorities of the family. I considered, I recently conducted a research in Bangladesh and India, and I found all of a sudden people are placing the highest priority on health, maybe because of COVID. And COVID has done certain good things to most of us. We are going back to the old medicines, what we call the traditional old Ayurvedic or Ayush medicines in India. In Nepal also, I believe Ayurvedic people are. So they are doing everything that can increase their immunity, right? So branches of certain trees, they are boiling the small tendrils, they are cutting them into pieces and boiling them in water and then gulping and swallowing the water. These kind of things, which was there in the past, and that did wonder to our body, but we had forgotten because of the English medicine that had come. Now, the socio-cultural dimension is very important. For 6 months, March, we started COVID. This is September end. We have not visited many hotels. We have not eaten in hotels. Are we not surviving? But there were times, in every Sunday, we'd go to hotels and we would eat junk foods. And that has really come down. We are not consuming junk food. It's also the family, how the family looks at junk food, how the family looks at the health priorities, the fitness priorities, or what is my lifestyle? Am I keeping late night or waking up early, late in the day, which I have started also doing in my personal life. I read late night and then get at around 7:30 most of the time, which is not a good habit. And if I continue with this lifestyle, there will be a time when I will develop all the lifestyle diseases. Look at what is the problem of COVID today. Every youngsters have been working with their computers and laptops for hours and hours. And believe me, this sedentary meaning sitting in lifestyle will lead to many diseases, lifestyle diseases. They will develop very young hypertension, then this, high sugar level, diabetes, and that will happen very soon because we all of us are leading sedentary lifestyle, which is not good. We need a mobile lifestyle. We should be allocating time to sports. We should be allocating times to dancing, which was very common in Indian society, and which has slightly music. We should follow that. That's the socio-cultural aspect. But what has happened? We say the India's GDP has grown and grown like anything. We are the fifth largest country in the world. But do you think the income has traveled equally to everybody? There is a lot of inequality. It is only 20% people who have grown rich. Only 20% people, or maybe 30% people who are leading life lavishly. It is true. 30 out of 100 the richer people in the world, they come from India. Yes, certain people, or certain, as I said, 20, 25 people have grown very rich. They lead lavish lifestyle. They have cars, swanky houses, but not in many Indians. 80% Indians still lead a very bad life. They still live in places, I know, even in Delhi, plenty of people live in places which are not habitable, absolutely uninhabitable. Go to Dharavi in Bombay, world's largest slum area. If you look at the way they lead their life in Dharavi, it's painful. That was the reason when COVID spread there, people thought that it might swallow Dharavi, but it didn't happen. People became proactive and started fighting with it. Now, if the socio-economical cultural dimension doesn't change, if we start following the Western culture, late night, net parties, all these things, junk food, that can continue. One can continue it for that for some time. But late 40s or early 40s, you will develop all lifestyle diseases, and that precisely has happened. India today has the highest number of diabetic patients in the world. The reason, one reason, and one of the primary reasons is that we are leading sedentary lifestyle, which is a very bad lifestyle. Sedentary means we are working, we are not working, looking at health, giving time to health. We are not exercising, we are not jogging, not doing anything. So that's the problem. And the family and the culture has a big role to there. When I call social culture, culture has a very, very big role. I've seen in South Indian families, they like dance. Even in Bengal, they go for dancing. Dancing is a very good form of exercise. Dancing also teaches you the beauty of rhythm. You know, rhythm. Life become rhythmic. Music makes your life rhythmic. So socio-cultural dimension we should not be forgetting. We should look at, and it influences my health, the kind of food I eat, the kind of places I live, my cultural life, what kind of culture influences me, what kind of food I eat, what are my habits, what are my behavior. So what these hotels and joints that have come in cities where youngsters and people of my age also go there. Uh, and you will find in every evening a lot of crowd outside, milling outside those joints. Why? People have money and people spend those money there. But once and twice is good. But day in, day out, if you're leading that life, that will definitely have a bearing on your life. So, socio-cultural life is very, very important. What kind of social life we have, what kind of cultural life we have. A vibrant culture makes a vibrant society. Culture is very, very important. The culture that we are now transitioning into is a very bad culture. We should look at our own values, old culture, and try to get back to that. And possibly COVID has taught us that go back to your culture, start consuming things that our grandparents did or that their grandparents did. And then the spiritual dimension, which is exceedingly important for good health. What is the spiritual dimension? Any idea? Those who follow Islam, those who go for 6-time namaz, they should definitely have good health. Have you seen any follower of Islam, the way they perform their namaz? The way they sit, the way they bow their head, the way they move their necks, those are part of their prayer. Everything is so aligned, beautifully aligned to their physical health. Similarly, the way Hindus worship, Hindus have to squat, they have to sit on the floor. We have forgotten the art of sitting on the floor, and that is the reason we all have arthritis. Because dining table, we sit in dining table and consume food, and not sitting on the floor. There was a time in the families, people will sit on the floor together and eat together. Sitting floor, folding legs, squatting on the floor. Those were all exercises that we have forgotten. And look at Hinduism, the beauty of Hinduism. We take early bath because without taking bath, we cannot worship. And bathing is a process of cleansing. Clean clothes that we should be wearing. That is what Hinduism teaches us. That without clean clothes, taking bath, you cannot worship. They were very scientific. It's not that people went madly after it, or they follow their faith blindly. Everything is so scientifically designed. So the spiritual dimension is very, very important. Am I worshipping the way I should be worshipping? Am I doing prayer the way I should be doing? People are going back to yogas. Ramdev Baba has popularized what India's greatest asset was. What we call yoga, Kapal Bhati. He taught us. It was India's thing, but Ramdev Baba should be given the credit. He taught every Indian to go for Kapal Bhati. Now, everybody is doing Kapal Bhati, even in the car, even in the park, everywhere you go. So, sort of exercise. Now, it is not spiritual as such, but you are making it is looking to make you look at you. Your beliefs, your values, they are very important for your health. If we neglect them, our health will suffer. Our mental health will suffer. Our physical health will suffer. So these are the dimensions of morbidity. I think I will not go to the measure of morbidity, which is very complex. I don't know what, Dr. Rakesh, do you have time? Should I go for measure of morbidity?
Yeah, we can just briefly now within 5-10 minutes close it. And,
okay. Okay. So measure of morbidity is these are the measure of morbidity: incident rate, attack rate, secondary attack rate, point of prevalence, and period of prevalence. So I'll go little by little, quite closely. These are the measures. So you can go through these slides. Now incident proportion. Say I've given a chosen point. In a study of COVID-19 between June and August, 100 out of 190 positive cases died during the period. So what is the incident rate of death? It's very simple. It's very simple. You have to look at the numerator. Numerator is 100 death. And what is your denominator? Denominator is 190. And if you look at the formula, it takes n, 10n. So how many n I'm choosing? What is the n value? 10 is called to the power 2, meaning 100. So 100 out of 190, and by 190, 100, it gives you 30%. So 30% people died between June and August. So incident rate is very, very high. If 100 people out of 190 are dying, my incident rate is very high. Or if people are not dying, change the example. 100 people got afflicted, then also the incidence rate is very high. Out of 190 people or 200 people, close to 100 people are got afflicted with COVID. So my incidence rate is extremely high, close to 50%. Secondary attack rate is something which is very, very important. A secondary attack rate is sometimes calculated to document the difference between community transmission of illness versus transmission of illness in a household battle. Like the COVID initially people say it's not a community problem, community transmission is not happening. Then they said it's only happening in a close family, close area, close barracks. But it started transmitting, and it transmitted to community also. One example will clarify your example, your thought process, and how it is different from the primary attack rate or incident attack rate. Say I've given again the example of COVID. So 15% in 15 different households reported positive. If the population of the community was 1,000, then the overall attack rate was what? I'm simply talking about attack rate, which is as good as incident rate. 15% in 15 different households. So 15 by 1,000 into 100, so 1.5%. I looked at 15% in 15 households. And I found the incident rate or attack rate was only 1.5%. 1 month later, 10% in the same household, meaning those 15 households. I'm not looking at the rest of 85 households. I don't know how many households were there. Say there were different number of households. I'm looking at only those 15 households that got affected in the first place. And 1 month later, 10% in the same household as these, they were in the primary cases, reported positive again for COVID-19. And for the time being, presume that 15 households had 4 members. So how many people were there in the household? Each household had 4 people. So 15 household had how many people? 60 persons. Of 60 persons. People is not the right word. Persons is the right word. 60 persons. So what do you get? Secondary attack rate. So now how many people have reported? 10 people have retired. Now what I do? 15 from 60, I take out 15. 15 ideally, in the beginning you remember, 15 people suffered loss, suffered illness. So 15 families, total population figure is 60. From that figure, I take out the number of people who suffered the illness in the first place. 15 people have suffered first place. They are our primary target here. So 10 has suffered this time. 10 divided by 60 minus 15 into 100, and you get 22%. Meaning secondary attack rate is very high. In a COVID situation, it's a very interesting data. Meaning, suppose a health insurance company wants to sell a policy, COVID-specific policy or health insurance policy. If he only looks at incident rate, then incident rate, what incident rate he got in the first example? Only 1.5%. What was the rate? What was the rate? Only 1.5%. Sorry, in this slide only 1.5%. But in the same community, same 1,000 people, say 60 people were there. 60 is what? 15 family. So 4 into 250 family are there. In that particular area, 250 family are there, and average size of the family is 4. So 250 into 4 makes 1,000. Incident rate is only 1.5%. But secondary attack rate is extremely high, 22%. What I am going to do as an underwriter, writing health insurance business, am I going to charge premium on the basis of incident rate? Not many people in India do it. I am not saying any underwriter does it. They may be understanding it, but they don't do it. Many of them don't even understand that I need to understand. I need to calculate secondary attack rate also. What I find, secondary attack rate is very high. It means that in the same family where COVID had taken place, the COVID cases are more. Initially, we were given the example that in a family, if somebody suffers from COVID, then he will not again fall victim of COVID again, because the plasma that you, or the antibody that you develop, is good enough to take care of it. In fact, the government of Delhi and other government started using the plasma of the infected person for others' lives, so that COVID can be driven out. But what I have come recently, I read news from Bihar, that the same person who suffered from COVID before, he again suffered from COVID, or other family members suffered from the COVID. What in this case I find that 22% is the secondary attack rate, meaning in a family of 250 in that community, chances of a spread of COVID is very, very high, right? So because I have taken only the 15 family, another test I can do, I can take 15 more families where COVID had not initially taken place. In this example, what I have taken place? I have taken the example of COVID infected family. And there we try to understand what was the rate of disease after 1 month. And then I take another 15 family where COVID has not taken place and then compare. If we find that the secondary attack rate is more than the incident rate of the other 15 family, because those 15 family have not suffered COVID, there I can only calculate incident rate, I cannot calculate secondary rate. And if I find the secondary attack rate is more than the incident rate, then I should not be either insuring this family of 15 family, or should be charging exceedingly high premium. So as an underwriter, I should have understanding. Some disease have high secondary attack rate. COVID, we thought in the beginning, will not, because we thought that COVID is not community transmission, doesn't take place, and that is the reason what happened. If in my office, some of my colleagues were sitting in a room, one gentleman called family reported COVID. We asked everybody sitting in that room not to come. Then we are observing whether the gentleman whose family somebody has suffered a COVID, whether he is also COVID affected or not. If he becomes COVID affected, then those who were sitting with them will ask them not to come at least for 6-7 days. So what are we trying? We are trying to stop the spread. So this is the reason when I'm measuring the risk of health, we must understand the incident rate, we must understand the secondary attack rate. So once again, I repeat, secondary attack rate is what? Same family which suffered. We try to understand what is the spread of COVID in those families again. Those chosen 15 families which had chosen. So they become the primary case. And from the primary case, we try to understand what is the spread of COVID, and that is called secondary attack rate. I'll take up questions. I will not go to many other things I have. I'll quickly, last slide, I'll show what we call burden of disease. This is how we today calculate health expectancies. Health expectancies measures life gained or years of improved quality of life. And we try to understand. I've given you in the chart healthy adjusted life, health adjusted life expectancy. If I'm leading good health, how many years it is adding to my health? So our health adjusted life expectancy, quality adjusted life expectancy. I'm 60. This year I become 60. If I start quality life, if I control my food, if I control my lifestyle, if I control my physical behavior, I go for, say, 8 rounds or 10,000 steps I go every day. Food I control, sleep I control. So I'm adding quality dimension in my life. It will definitely increase my life. You can do it at your age also, 40. You can do it at your 30. So what if I need quality, add quality to my life, it will increase my life. So that is the reason it is known as quality adjusted life expectancy. And these are very, very important way of looking at population health. What is the disability adjusted life expectancy? This is a little complex. This class will not be able to make you understand. But look at this. Today we are everybody talking. If you read newspaper, what is disability adjusted life years? So first we were looking at life gains. In health gaps, we look at what is the life we lost. What kind of life we lost? Suppose a young man at the age of 40 had a massive road accident and he starts limping. Don't you think that his quality life gets curtailed? He will not be able to take up new jobs. Even in the same job, his productivity goes down. He may live longer, but he will live longer with disability. Look at the age of 40, if somebody gets afflicted with diabetes, he has to control his diabetes all his life. Anytime, any moment, he disregards this, he will be in trouble. So what do? We look at that what a particular disability, to what extent that disability has reduced our life. And that is called disability adjusted. So any disability, as I said, at the age of 40, you had an accident, somebody had an accident. It reduced my productivity. And when it reduced my productivity, what kind of life I lost, I calculated through DALI. We call it disability adjusted life years. And it has two components. DALI has two. So what do? What we need to do is that we need to improve quality and try to bring down DALI. And DALI has two components. DALI has two components. I'll show you. I've given you YLL and YLD. So in an accident, 40 years, somebody dies. His life expectancy in Nepal is what? 70 years. At the 40 years, he dies. Somebody dies. So 30 years of life he lost. So a year of life lost was what? At that particular point of time, 30 years of life he lost. That's one way of looking at DALI. But he did not survive the accident. But he lived with disability. Disability is what? His one leg has to be amputated. His productivity goes down. But he lives from the age 40, maybe 60 or 5 or 70. Or he dies a little early also. Or maybe lives up to 70, which is life expectancy at birth in Nepal, or 68 in India. But from 40 to 65 or 70, he lives with disability and it curtails his life. That is known as years of healthy life lost due to disability. One DALI can be thought as one lost year of healthy life. One DALI means what? When I say I lost one DALI, it means I lost one healthy life. 1 year of healthy life. And today, the world population health is calculated in term DALI. India's DALI is extremely high. And therefore, India's population health is bad. So population health, I look at with the help of DALI, which is YLL and YLL. I will end my presentation here. If somebody feels that we can go for some other session, I'll be more than happy to take that, where I can only talk about burden of disease, which requires a little understanding, a lot of time. So what did I teach you today? I taught you about the definition of health, meaning what exactly is health. Health is not only the physical health or absence of disease or infirmity. It is physical, mental, and social well-being, and which also gives you the ability to lead a socially and economically productive lifestyle. Then we talk about dimension, the cultural dimension, the spiritual dimension, the social dimension. How does it affect the health? And that we talk. Then we talked about the measurement of Russell rate. What is incident rate? What is attack rate? What is secondary attack rate? And how will it help the underwriter? And briefly touched upon the burden of disease, where I try to make you understand the health gain and health lost. So if you have any questions, I'd love to answer those questions.
Yeah. Thanks, Dr. Chattoraj, for the informative session and explaining the multiple dimensions in health risk quite vividly. So if we have, since we are already running out of time,
Yeah.
I think I would like to invite Dr. Atreya to just come in and give a concluding thought.
So nobody has question.
Yeah, there is one question from. I think that is based on particularly on insurance. After COVID, you can see the chat box. You can see the question, or should I read it out?
Not able to see. If you can read the question, I can answer.
Okay. After COVID-19, as we found comorbidity and certain cases where above age 60 are at higher risk.
Yes.
So in upcoming, your opinion on senior citizen plans premium will rise drastically.
Comorbidity is not such a phenomena which only the senior citizens suffer. As I said, the onset of lifestyle disease like hypertension and diabetes because of sedentary lifestyle, the kind of lifestyle we are leading at today, starts very early. But you like to say, if there is a comorbidity case, the seriousness of COVID is very, very it has been seen that I don't know empirically proved or not, that patients with comorbidity, particular diabetes and hypertension, the chances of death is very high. So patients who have comorbidities, either at an advanced age or at a younger age, I've seen many young people also dying out of COVID. And then a little bit of investigation, and I could understand, particularly from diabetes. So it can be very, very fatal. So COVID is highly fatal in case of comorbidity, and it needs to be tackled very, very differently in case of comorbidity.
There is one more question from Ms. Mahua Datta. What's the scientific basis for risk assessment?
Risk assessment.
I think yes, scientific basis for risk assessment. I think
health risk can be very scientifically calculated. In fact, it is very, very scientifically calculated. So when I talk about population risk, when I calculate the tally, when I calculate the incident rate or incident proportion or prevalence rate, I would like to know from Mahua Datta, if it comes.
I think again we have some connection problem with Dr. Chattoraj. Can you hear Dr. Chattoraj? Dr. Vinod, you can continue till he comes back.
Yeah, okay.
Yeah.
Thank you, Dr. Rakesh. Thank you very much. First of all, let me thank.
No, sir, I think he is having some issue.
Yeah, no issue. Dr. Vinod is there.
Vinny, is there anything? Huh? Where is the noise coming from? Anyway.
Yeah.
Thank you, Dr. Rakesh, for organizing this webinar in collaboration with the BIPIN. Basically, we are very much delighted and we are very much happy to collaborate together with you and conduct this type of webinar in the future as well. So we'll be continuing this dialogue again and again, and we'll be continuing this webinar collaboratively in the future as well. Okay. First of all, thank you very much. Second, let me thank you to our presenter. Basically, what he said that we should have the good health. Means we should have good health. So when we said good health, it is socially and economically productive life. That is what he means by the good health. So he was quite descriptive in explaining the health point of view. But to be very simple, my understanding is that we need to look into the economic indicator and the social indicator to measure the health. So the mortality rate is there, population rate is there, mortality rate is there, and education rate is there. These are some of the livelihoods rates are there. So there are many social indicators which are representative of the good health. So means hospital to pay, hospital to sit, means population rate could be there. So there will be many ratios, many health indicators that will be very important to measure where we stand at the moment. Likewise, again, the economic indicators are also very important, because to make our life happy, we need to have the economic well-being as well. So truly, health is wealth, means we have to take care of the health. If our health is there, then we can earn money, we can work again, we can live prosperously, we can be happy, we can be together with the family. If our health is poor, then we'll be losing many things. Many things. So this is what we have to say. Now, coming to our BFIN, Banking, Finance and Insurance Institute is a capacity development institution created by the banks and financial institutions. So it is promoted by 16 institutions, 16 commercial bank, development banks, finance company, microcredit institutions, and the Emerging Nepal Limited, which is represented by the government of Nepal. So we are a public limited company, and our main objective is to provide training. We are in the areas of consulting, we are in the areas of research, we are in the areas of financial literacy, we are in the area of online training program and recruitment and other services. So our main purpose is to provide a one-stop solution to the banks and financial institutions in Nepal. So that is the main objective of these institutions, and we are collaborating with many of the international providers, capacity development providers, like RMIA is one of our strategic alliance. Likewise, BIMTech is also our strategic alliance. We have a JNIBF, a strategic alliance. We have a strategic alliance like BIBM from Bangladesh is our strategic alliance. EPRACA, which is a forum for the central bank of the Asian countries. We are also having a strategic alliance with them, and we have the CPSC, Colombo Plant Staff College, that is also a the international organizations for the Colombo Plant countries. We are also having a strategic alliance. Again, we are also having a strategic alliance with many of the universities. Like we have the strategic alliance with the Victoria University from Australia, Melbourne, and we have the Westcliff University, California, and we will be having much more international relation in the future as well. So the purpose of having this international relation is to strengthen our network, work together in the areas of research, consulting, webinar, training, and so on. So we'll be inviting a resource person from RMI in the future as well, in our webinar as well as in our training program, and we'll be conducting webinar and training together in the future as well. With this, again, let me thank. The time is limited, and I know. Let me thank Rakesh for this collaborative program. Thank you very much, and thank you, Benny, who is our techno lady. She is very efficient in the technology field, and she will be coordinating again. In Tuesday, we have another program with another agency from India. She will be coordinating again, and she is a perfect lady for the digital world. So with this, again, thank you to RMIA, thank you, Benny, and thank you to all listeners who are here. And let me tell you that BFIN and RMIA is organizing online program. There are a lot of online certified courses that we have announced. Like BFIN has also announced, it is in our website. RMIA has also announced the online training program on risk management. That is a certified course in collaboration with London. So if there are Nepalese audience over here, my bankers colleague, or any audience from India also, please take the opportunity of these online courses. Those are certified courses, and you can write after your name those titles once you complete those courses. And I think this is the opportunity we should be sharing. Rakeshji,
Yeah,
Whenever
definitely.
you should be sharing what knowledge we are trying to spread in this world. That we should share. We should let the audience know, so that it's up to them to choose where they wanted to go. With this note, let me thank you again, and thank you again. Thank you very much. Thank
And
you.
in fact, this COVID has given us the opportunity to collaborate and join in such a short notice and get the best out of the faculties. So I would like to thank Dr. Atreya, Vinny, VIFN for collaborating with us. So we'll be coming with more such sessions in future. And thanks to all participants from India and Nepal for joining us. So we'll be again back with some other session, maybe next week or so. So thanks everyone. Thanks for participating. Thank you.
Thank you. Thank you. So let me go off. Okay, Vinny.
Yeah.
Bye bye.
That's it. Hello.
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 Yeah, we have ended the session.
Okay, okay, okay.
Yes, yes.
Acha, acha. Sorry, because of my.
No, no, yeah, the internet connectivity issue.
So Mr. Atre is there or left?
No, he has left.
Okay.
Okay, then we will close it now.
Okay.
Okay. Thank you.